How are you doing today?
Good to see you, Nick.
Good. You sound a lot better.
Feel a lot better. Still a lot of pain, but feel better.
Where's your pain at right now?
Right around here, mostly in the chest, but
the chest tube's out, so he really is he's a lot better than he was.
Good. On a scale of 0 to 10, depending where's your chest pain at?
5 to 6.
5 to 6. Okay.
5.
Yeah. So when we first started, you were about a 9 or a 10. So that's
It was rough.
a lot.
It was rough.
Good. So it looks like we're planning to discharge tomorrow morning. Has anyone talked to you about our discharge plan yet?
I've talked about it with the physician.
Okay.
So this is my brother Jack.
Good. Hey, Jack.
So Jeff and Jack, easy to remember his kids. So he's out from California, and he's gonna be able to come stay with my wife and I.
Okay.
And help take care of me. I talked to the physician. He said I can go home, and as long as Jack's there to help me. So.
Okay. So what I have on my paper is different than what the physician's saying then, because we have you going to a SNF.
What's a SNF?
It's a skilled nursing facility. It'll be you living in a facility, getting rehab once or twice a day, just kind of help with your chest and help with the stroke that happened, and then discharging home.
I mean,
Does that make sense?
Yeah, I mean that makes sense. I feel like my physician already said it's okay.
Right.
I don't want to spend any more money because my wife's the only one working now.
Right.
And Jack can do it, so I figure that's easier to go to home.
Right. So my main issue with that is on the eval a couple days ago, you were what we call a mod assist, which means it took me doing more than 50% of the work to get you seated and get you standing and get you walking. That's not something that we like to send people home with. We like sending them to a SNF where there's another trained person or trained healthcare worker to perform those tasks. It's also somewhere where there's 24/7 care. Are you working right now, Jack?
No, I'm not. I'm usually in California doing construction, but like I don't have any job right now, so I'm moving in to help out and everything. So
Okay.
I'm not working right now.
So you would be available 24/7 though, right?
Yeah.
Okay.
I bet. I mean, he's a smart dude. I bet he could figure all this out, especially if you're to teach him some pointers.
Okay.
I bet he could do it. I'd rather go home. Like I don't want to go anywhere else.
Well then, before we get started with treatment, there is an assessment I want to do today. It's called the 6 clicks, and it just kind of will give me a score to justify where we can send you. It's backed up pretty well. It's been researched. Are you okay doing that today?
I say let's do it.
Okay, cool. So, have you had any more issues breathing lately? Remember how
I still find that like if I move too quickly from one place to another, like I kind of get like shortness of breath. Like it's hard for me to get back to breathing normal, but like I'm usually pretty good.
Okay.
Breathing a little more deeper than last time, especially with that chest tube now.
Good. So, first thing we're gonna do then is I'm gonna go and put this gate belt on you. Okay. We tried it last time with that chest tube. It kind of got in the way.
Yeah.
Where the chest tube is gone. If it gets up close to where that chest tube was, tell me and we can re-cinch it down. Okay.
Yeah, you can make it tight.
Okay.
That's okay.
Go ahead and lean forward.
You can get it as tight as you need.
Yeah, so I mean, you and I walked.
Yeah, you can get tighter.
3 days ago. First time was kind of tough getting it out. And the last couple of days.
Okay, cool. So first thing we're gonna do is we're gonna do a stand up, and we're gonna actually stand up, rotate, and we're gonna sit down here on the bed, okay?
How do you want me to do it?
So,
You want to push up?
you can't really push up right now because our sternal. Do you remember your sternal precautions?
I forget about it all the time, but
Okay, go ahead and
You did tell me about them.
what you remember from it.
don't raise my arms up.
Okay.
Don't put my arms behind my back. Reach
Okay,
in my
so
back
like that.
pockets. Don't push or pull.
Okay,
Can't carry heavy stuff.
how much? 8
2
pounds.
gallons of milk
2 gallons
is
of
my
milk,
limit.
which is about 2 gallons of milk is 8 pounds.
Okay, so,
So,
all right.
2 gallons of milk, or like a 2-gallon jug, that's the limit. Okay?
Okay.
Also no like going out the sides,
Oh,
or
yeah,
going
yeah,
straight
yeah.
up here too high.
That's right.
You said reaching back, and then no like laying on your stomach or driving. Okay?
Yeah, none of that.
Okay?
And then you said something about the tube.
Yeah,
Stay in the
so
tube.
we're in a tube. Okay, imagine we're like stuck in just, I don't know, playground tube. We can move up here in the tube, like to our face or down beneath, but as soon as we start trying to go out, we're stopped by the side of the tube.
Okay.
That make sense?
So I can go like this.
Yep, that's totally fine.
Alright.
Okay, so I'm gonna help, but I need you to do as much as you can. Okay, that'll give me the best score on this. So the first thing
They feel a little bit better.
is we're gonna stand up,
A
so
little,
try and
little stronger.
scoot forward a little bit as far as we can in the chair. Good, good. And now we're gonna lean forward and we're gonna try and push up, okay? 3, 2, 1.
There you go.
Good, good. Okay, feel okay?
Okay.
Okay, let's have you try and just shuffle our weight and let's sit back down over on the bed, okay? Okay.
Am I good?
Yep, try and slide that just a little bit so you feel the bed against your knees. You good right there? Good. Okay, now go ahead and just slowly sit down. Good. You feel okay right here?
Yes. I'm a little tired out,
A
but.
little tired from that? Okay, the next thing we need to do is we need to lay down now. Okay, same thing, I need you to do as much as you can. So let's go ahead and bring your right arm across your body. Good, hold it, or just kind of tuck it in,
Yeah.
kind of thing. And we need to swing your legs up and get you laying down.
I don't think I can get
Okay,
that leg up.
so I'll help you with that leg then, okay?
Okay.
Okay, you ready?
Okay.
And swing, drop. Good,
Can you get these pillows for me? Lay down.
good.
Yeah. It's hard to breathe, like, if I'm not prompt.
Okay. Go ahead and relax your legs and just bring them down.
Okay.
Okay, and just on your own, I need you to try and like you're tucking yourself in. So I'm gonna put this down here. I need you to grab it and try and pull it up.
Your situation like at home? What floor is your bedroom going to be?
Okay? Good. Now, like your cup of water's over here. Try and grab my hand like it's a cup of water.
Grab it?
Yeah, just try and grab it on your own. if you can. Good. And then are you able, let's see if you can roll, just bring yourself over to that other side facing that wall, okay?
That you could temporarily turn into a bedroom?
Would you suggest that we?
Okay, we're rolling back
For
over
the
now.
short term, I can see that being very beneficial, just so we don't have to, or you don't have to deal with getting up and down the stairs quite as frequently. Stairs is something that we're gonna
Okay.
Okay,
Just like that?
just like that, yep.
do the stairs in the future, but right now.
You mean I didn't need me there? The OC.
Tough, man.
You got it.
Okay, good. Next thing we're gonna do, I wanna see,
And is the.
laying here, if you can sit up at the edge of the bed, okay?
The full bathroom is on the second level.
See
There
that?
is like a-
Yep, we're gonna try and sit up at the edge of the bed.
Okay, so leaving the general second floor, so these two are first floor.
How do you think you're gonna be able to do that? Walk me through what you're thinking.
Tried stairs.
Can't really
last couple days at all?
use my leg all that well, so it's better than what it was, but, can't push with my arms to get up.
Going from that standing position.
Okay.
I don't know, I could be able to get my leg off. I don't know, I'm gonna get my body up.
So we do what's called a log roll, okay?
Okay.
So what we're gonna do is I'll help bend your right leg. Let's tuck your right arm into that side again. And we'll roll you over. And with this arm, I just kinda want you to lightly push off the bed and I'll help scoop you out. Okay?
It's not your best.
And Jack, go ahead and watch just in case we do go home. This is how we're gonna have to transfer out of bed, okay? Okay, so go ahead and bend your left leg up.
Yep.
Take care of your right. Good.
You'll be able to.
Okay? Actually,
So the next thing I'd like to go.
slide you a little closer. Try and wiggle towards me. Just a little bit. Good. Okay. Now we're gonna roll ya just a little bit. Have your legs going. Okay, ready? And now with that left arm, try and push up as much as you can. Okay, feel okay?
Yeah, I gotta just breathe a little bit.
Yeah.
So you're basically doing like a baby carry, like kind of what?
Kind of like a baby carry. It's getting your arm under this leg and your other arm here, so we're just swinging and sitting. Okay.
I can't really use this leg at all. I can't really push off right now. The scar's right here after my surgery.
Okay. So now the next thing, we need to try standing up and walking. Okay, and we struggled a little bit last time, or we should have struggled a little bit last time.
That was a struggle.
Okay. So stand up, we're at the edge. We're gonna kind of what's called nose over toes. So we're gonna look down and just try, just with your legs, just stand up. Ready?
Okay.
Okay. 3, 2, 1. Push off.
Does that kind of make sense?
Good job.
So I can't rotate his chair here.
Good.
I'm gonna get his legs sort of firmly underneath him.
Okay, how you feeling?
See right there, I feel pretty good.
Okay, but if I let
What I'm
go,
gonna do here is just.
I don't want you to let go.
yeah.
Out and like that. I'm
Okay.
gonna use my knees.
I don't trust this leg.
You don't trust that
No,
leg?
no.
Here.
Okay, so let's try and try and step just on that right leg then. See if you can step forward just a little bit. Good. What about that left
I've
leg?
been told. So we're blocking his knee, make sure it doesn't go
Good.
anywhere.
Try right leg
Right
again.
arm, we'll have him hold with his left grip. We don't want him
Left
pushing
leg?
through anything for at least a couple more weeks.
Right.
It's gonna be 6 to 8 weeks.
Good. All right.
Check on that.
Feel okay?
I feel pretty like unsteady.
Yeah.
I really don't trust the leg. Like I could not put like all my weight on my leg.
Okay. Let's go ahead.
Like I can take a step, but you're right there. So
Okay, the chair's right behind us right now. We're gonna just pivot around and sit back down,
Does
okay?
that
And we'll
make
talk.
sense? So far, do you have any
Okay.
questions?
So do I just need to like just lift him straight up with that?
Yeah, it's kind of grabbing onto his waistband and grabbing on to the gate belt, which we can send you home with the gate belt to pull up.
Okay.
However,
So let's scoot you over just to the left. Down.
let me hear you do some math.
Look right down.
Sit back down, sorry.
So if he was in bed here, we've got the edge here, what we're gonna do is we're gonna bend his knees, so we're gonna bring this one up for me too. Good.
So to go home, based off this, he needs a 17 or 19. Okay? And right now, we're 4, 8, 11.
Important thing to keep in mind. You want to rotate the positions with him. You might have some lightheadedness.
We're at about a 15. Okay? So he is a little bit less. He's a little too low to go home. He fits in the category for the sniff though. Now a sniff stay is anywhere from a month to 90 days, depending on your insurance.
Well, he's just here in the seated position.
That is my recommendation right now, is to go to the sniff, get a little bit stronger, take care of just that right side of weakness we've been dealing with, and then discharge home. But at the sniff, they can also help you and teach you more so that when he's ready to go home, you're ready to be there to help. Does that make sense?
it does, but I mean,
I think I can do all that. It's pretty simple.
with what's going on, I mean, Jack knows being in construction. COVID's been terrible for us. My wife's like, her job's like, who knows what's gonna happen with all the regulations they're doing with schools.
Right.
I mean, that's all she's done, and she's the only one right now. I mean, how long, like, is it realistically gonna take me to recover? She's the only one that's gonna be making money. Our insurance is not the best.
It's really based on you. It's how much effort you're willing to put in at the sniff. Right now is good timing though. We're in January. It's winter time. Construction's probably not popping. Like it's not that busy, right? Like my father did construction. He was always pretty slow right now.
Yeah,
So
nothing going on right
if
now.
we could get you going right now and getting you in that sniff and really working in the sniff, then getting you back by summertime when construction is always busy regardless, that'd be our best bet. That'd be the main goal.
I hear what you're saying, Nick. You're a good guy, but I just really want to go home. And the physician already said it was good to go. I just feel like that's where I need to go at this time.
So at home, you do a 2-story home, right?
Right, yeah, like what am I gonna need to do to figure that out? Cause the main bathroom's upstairs.
Yep.
And the main bedroom's upstairs.
You can't even, we did 4 steps right there, and I was having to do a lot of the work. Right now, I don't think stairs are possible.
Forward.
Can we do stuff on the ground floor then?
Do you have
Like,
stuff on the ground floor? Do you have a bathroom,
Half bathroom.
big enough bedrooms, the shower's still upstairs?
Yeah,
Bring
should,
the hose there.
Come down.
isn't there like portable showers and stuff? Like,
Those aren't
I
the
don't know.
best, we don't recommend them just because they don't get you as clean as you need to be. But if like, and is there big enough space downstairs for you to sleep?
I mean,
And to put a bed?
I mean, we're middle aged. No one really comes and visits us besides the kids.
Put a bed that
I
you
don't care sleeping downstairs. for a
Get
while.
out of. Because like these hospital beds raise up and down and make it pretty easy to get out of, but they're not as soft as our beds at home. Like I have a purple mattress, that thing is like you sink in.
I've heard about those.
So being able to get out of one of those beds or getting out of a sofa or out of a chair is a lot harder than these hospital beds and these chairs.
We could look into trying to see if we can get you like a hard one, if anything.
Don't recommend doing this.
I feel like having Jack's help where before like I didn't know what was gonna happen. I feel like having him there, he's gonna be there the whole time. I don't know. I feel more comfortable just being around my family. To be honest with you.
Okay,
I do see the benefits of what you're saying with the sniff. I do, but I just want to go home.
okay. Let's go through today's exercises, and maybe we'll talk about it at the end with my CI, okay? We'll just go from there.
Okay.
Does that sound good?
Yeah. Whatever you can do to help out Jack know what to do, you know, based on what you're seeing. He'll do it.
Yeah.
Okay.
He'll figure it out.
So we're gonna do a lot of seated exercises right now, okay? We're really gonna be focusing on that right side. So for that first one, what we're gonna do is they're called heel digs. So we're gonna try and just stick our leg out a little bit farther and just try and like we're taking our shoe off, just dig it into the carpet, okay? Let's go ahead and try and bring that leg out just a little bit farther and stick that toe up a little bit if you can. And now just try and dig it back in. And I'm gonna peel back here, make sure, see if we're actually working that, okay?
On both sides.
Okay, pull in, pull in.
But it's really wide. It's wide enough.
Good. Let's try one on our left leg.
Sure. Should be much easier.
Good.
It's easier for me to do it.
Yep, and we're gonna hold these like digging in for 10 seconds, okay? And we're gonna do 10 of them. Okay, so let's go back to that right leg.
All right.
Let's go stay in position. Actually, let's get your shoes back on first.
Good. Let's go with this left leg now.
And he's slipping on the stairs.
These hospital socks are fantastic.
I know they are, but these hospital shoes are more
I can tell you the product than the hospital socks, but he didn't.
Just
Good.
random.
Let's
We need
go
to
with the right leg.
just go for it?
Just keep going. Yep. We'll just keep working.
Okay.
Fuzzy socks. You know, these ones have some sticky stuff.
Those do not fly in a hospital.
No.
Socks.
Well, they definitely make patients fly.
Not good. Not good.
So much harder on that side.
You got it?
When you're feeling ready, we're gonna walk over those stairs. If possible, Joe, if you wanna grab this wheelchair, just follow us. We're really picking up pace here.
Good. That's 10 right there. Next one we're gonna do. How are your legs, Joe?
Tired.
Okay.
Tired.
Let's
Sore.
do an arm exercise there. Give her so we're gonna do a bicep curls. You're a big guy, right? It's here. So just imagine that we're gonna work on our right arm first. Yep. We're gonna place our left arm here, and I want you to just try and push up into my hand.
Pushing nice and firm to your left.
Just like that. Yep.
I'm trying to like actually move it.
Yep. You're trying to move it, but just make sure that your hand's stopping it. Okay. Good. Relax. Now go and put your left hand there, and let's try it again. We're gonna do 10 of these. We're gonna hold in there for 10 seconds. Okay.
Taller stairs. Those are more like what you'll have in the home. I gotta see how well you can do those. So we want you to make sure you can get up there for bathing purposes.
Good. And if it starts getting too tight where you don't think you can hold it for 10 seconds, relax how much, like,
Just a little one. It's a
don't
bonus.
push as hard. We're trying to like move grams, not pounds. So So push a little softer into the hand, okay?
Okay.
Let's try to get on
Not
it.
carrying all like the beams and stuff, you know.
Mhm.
It's like, okay.
Down with the left again?
We can go down with the right twice.
How does it feel going down with the right?
Man, I don't know if I can hold it for 10 seconds.
Good.
I
Okay.
tried to go less.
Try and give it a little less pressure than that time. Try one more, just a little less.
Okay.
What do you think? Is that more difficult for you than going down with the right first?
I mean, I feel like it might be a little bit easier.
Let's continue with that.
Okay.
I feel like.
Good. We're
So
still
where's you out?
Really
Yeah.
isn't strong
I'm gonna try one for the back bar. It's called the tricep now. Okay. So we're gonna put our hand down here at the bottom and then try and push in like that. So if we're on this side,
Yeah.
just kind of resting it there and push it. Good.
You're feeling it now. We're wired. Yeah. What would you put your
Pushing a little too hard, so go and just ease off just a little bit. Okay.
Okay.
Go and try one more time, and then we'll switch, and you can do it with your other arm. Okay.
Probably like 14.
More like that?
That's a little better. Yep.
We want to keep it at 13, 11 to 13 range, okay? So what that means for us right now is that the taller
Good. Go ahead and
stairs
switch me.
are
Put your left hand under there.
and it's probably a little bit too difficult right now for me in the home. That is something we'll continue to work on. There's the potential for maybe home health physical therapy. Somebody can come to your home after you get stretched here and work on the same things. Does that make sense? You feel comfortable walking back over to your bed, or do you want us to?
Good, do one more.
Back?
Yeah, I
Still got the energy for it?
I can walk, just give me a minute to rest.
Yeah, we're not in a rush. 2 minutes later, you go great.
2 minutes later, man, I'm ready to go again. I'm from a family of warriors.
Good. Take a break for a second.
Well, inventors and warriors.
Your mother's side was the Warriors.
I've been moving it. Hopefully. Wearing me out though. Crazy.
How you feel?
I'm a little humbled.
A little humble.
Yeah, but way better than what I did before. I still, like, I feel like just like a 5, 6 out of 10.
On your chest
Not
pain?
Yeah.
Okay, you're not short of breath or anything.
My muscles are just sore.
Doesn't hurt to breathe. Looks like your vital signs are still okay on the.
Yeah.
Okay.
But, you know, not too bad. It's
Alright.
nice that I can kind of do,
We'll say
I mean, a little bit of stairs. and walk.
blood pressure is like 105 over. Sorry, that's heart rate. Heart rate's gonna be about 105.
Okay.
Blood pressure is like 150 over 80.
Short distances, you walked across the hospital room. You did the shortened stairs, not quite ready for the taller stairs. Just a little bit
Okay.
difficult, but we're making progress so fast.
Next things we're gonna do are standing. We're gonna do what's called a weight shift. Okay. So we're gonna stand up and we're gonna try and just, as we're standing, our right leg, our bone, we can't really put a lot of weight on that right leg right now. So we're gonna start on our left and we're just gonna try rocking, just back and forth, and just work on putting weight on that right side. Okay, and I'm gonna guard you. I'll help you stand up and stuff. Okay, and then we'll kind of rock together. Sound good?
Let's do it.
Okay. So, be sitting in a chair like this, just with his right side being weak, we want to be on the right side. Okay.
Yes.
So what we're gonna do, we're gonna kind of keep our knee here against his knee. Okay. And then with that right arm, we just want him to tuck it in so it doesn't get caught. Yeah. Go ahead and slide forward a little bit from the chair.
I can't.
Good.
Kind of wiggle.
Okay, right there is good. Just go ahead and so you're gonna lean over your toes. So we say nose over toe. Okay, and we'll give a count.
Huh?
We'll go 3, 2, 1.
Definitely going to be.
Good. And then while he's standing, we'll kind of keep that right leg there. Or knee
Just
there.
on the outside.
Yeah, just so it doesn't buckle. Okay. You feel okay? You dizzy at all from standing up?
Take a break there.
Okay, go ahead and try and rock over to your left leg.
Okay. So we're trying doing it?
Yep.
Same
Okay, so try and rock over to that right leg.
You're probably gonna have to break the halfway point. This isn't gonna be a permanent.
Okay, let's try and rock to the left.
Get that endurance back. Does that make sense for both of you?
To the right.
Do they have like a chair or something? Cause I don't know that I wanna stand the whole time.
I can put a little bit of weight on it.
Good, let's try
how should I do this? If you make me, I'm gonna do it at home, right?
This is
Gotta do it
something
at home.
we'll just do in therapy, just because there's a little bit more guarding involved. The other stuff we'll send you home with, kind of those three things we went over earlier.
Okay.
So,
Yeah, we've done a little bit with using it, I was just, I wanted to make sure that if there was one that I could get for my place, that I could, cause
okay, let's go ahead and sit back down in the chair right behind us. Go ahead and scoot back as much as you can so you feel it under your knees.
Okay.
Good, go ahead and slowly sit back down. Good. Okay.
As far as other equipment we get,
So, gone over supine to sit transfer, then the sit to stand.
So we can also get.
The next thing we'll cover is just from a chair. We call it just like pivot transfer.
Okay.
It'll just be from a chair to another, so like his bed, the couch, call it maybe like anything like that. Okay.
Medium distance, maybe travel that you might have to do,
That.
that is a little bit
Okay.
too far.
So we're gonna kind of do the same thing.
Just as we're kind of going ahead, there's having chair available to you.
Yeah, make sure you do it. He does. It feels fine when he's there.
Okay.
Cause I can't do it. I don't trust his leg stuff.
Since you're walking pretty well, or walking with someone that you don't
Use that chair.
hesitant about getting walker just because it does
We'll use this chair.
give you the potential to. put
It's gonna be the bed. I should have stood the chair closer. But, okay. Same thing. So we're gonna have a sideboard again.
We can always slide it over when these things done.
Any other questions from either?
It's okay. We'll need this one because we're almost done. Good right back.
Okay.
And we'll do the same thing. Go ahead and put your right out in here. And kind of hold it with your armpit. Good. And we're gonna grab here. Okay, we're gonna kind of lock both knees. Okay, ready? So sit up. Swing over. Hip. And back down. Okay? That makes sense? We're gonna pick up. Okay, let's go and go back now. Ready?
Yep.
Just knees on the outside.
Knee on the outside, and we're just kind of sitting up, swinging, sit back down on the edge. Okay? Any questions?
I don't think so.
Okay.
This far, and he needed a break at that point.
That's it for today.
Say that same, 30 feet would be appropriate.
I'm gonna go talk to my CI and the other therapist that's been working here. And we'll bring them both in and kind of talk about the sniff a little bit more, okay? Okay.
Can you pause?
Oh, no worries.
Talk to my CI, he's another therapist here. He does agree that the sniff is our best bet, just with how things are going. The care there will be a little bit better, rehab, just everything there will be a little bit more accommodating to where you are functioning right now.
So I remember the sheets.
How do you guys feel?
Forgot to put socks back.
I mean, I respect what you guys do. I mean, I feel like you guys are helping me out a lot, but
Okay.
just with like the circumstances we're going through, and frankly, my brother too, you know,
Okay.
on his life, I feel like it's beneficial to us if we can just fight and just go home.
Okay, so, then with that, let's talk about a few things we might need at your house. You said there's a half bath downstairs, correct?
Yeah, the full like master bedroom, bathrooms upstairs.
Okay.
That's 15 stairs.
Okay, so stairs probably aren't a thing right now, just with where you're at.
There's 4 stairs to even get in the house.
There's 4 stairs to get in the house.
It's like
Is there a railing
it's
on
like
either side of the
like an
stairs?
old time house now. You know, I describe it like super wide, like porch area and stuff, and stairs. I can only hold like one rail at a time.
So there's a railing?
There's railing on each side, but like one person can't grab both sides. You know,
Okay,
to like walk like
it's too wide, we'd be up here.
maybe
Okay,
like 3 people.
okay. So, inside the house then, is there a room big enough that you could fit a bed?
Yeah, there's like kind of like an open living room area downstairs, kitchen, dining room, like table area,
Okay,
and then like the hallway down there. Before you get to like where the garage goes is the bathroom.
okay. Would you guys be willing to buy a hospital bed? If you get a hospital bed, we could raise it up and down. It could go on an incline, so you're not always laying down. it'd be easier to transfer out of than just a normal bill.
If you know where to,
We can talk with the
like figure out where to
social
find
worker.
one, yeah.
Yep, okay.
Okay.
And then in that bathroom, what we're gonna need to do is we're gonna need to get a grab bar installed. It's like, it's almost like a little towel rack. It's a lot
Oh.
sturdier, but it goes right in front of the bathtub. Or not in front of the bathtub, like near the toilet, so that we can grab off and kind of help ourselves lift up.
Yeah.
That's a little out of the way because of our sternal precautions though, but that's something we're gonna have to look into. We can also get a raised toilet seat, it's just like booster almost. It'll make it easier to stand up from the toilet.
Okay.
We'd need,
You writing this down, man?
I'm ready.
Looks like he's writing it down,
Oh,
so.
oh,
Don't worry.
I probably won't remember it.
Bathroom
Next.
still. We'd need to get a shower chair. Is there a bathtub downstairs or shower downstairs? It's a half bath.
No,
Nothing.
it's just like, I mean, it's pretty good size, but it's just like the sink and,
It's just the sink and stuff.
toilet, you know.
Okay. Then we could.
I mean, I've seen like on TV when I'm watching these people do like long distance racing, like sometimes if they get dirty or something, they have like transportable like showers and stuff, and you just hook it up to like a pipe and feed water into it.
We could try that.
I don't know.
My main concern is that your sternum is still healing,
Yeah.
and that just, if we're not doing a good job cleaning ourselves, it's not gonna like it could get infected super easily.
Sure.
So
So when it comes to that kind of thing, you could even ask an OT to kind of be involved, right? For
Yes.
bathing.
we'll talk to OT about that.
Okay.
Okay.
But how are they gonna get in the house?
That was my next thing.
Yeah.
I was gonna cover everything. So there are 4 stairs in your house. We'd need to be able to navigate those stairs effectively. Have you tried stairs? I know we haven't done it here.
The nurse had me try something.
Were you able to go up the stairs at all?
I was able to get up on it, but I needed their help.
A lot of their help.
It's a brave nurse.
Wild nurse.
Someone, I'm on drugs. I don't know. Someone made me do a step.
I'm thinking you had a dream about doing stairs last night.
So,
On a lot of medication.
and that's the only entrance into the house. There's nowhere that there's like a small lift, garage door, anything
The garage is its own like,
separate.
yeah,
Okay. Okay. Well, let's go ahead
very kind of old timey.
and go work on some stairs then, so we can kind of talk about how to go up some stairs. Okay.
Okay. Let's say he can do stairs because he is able to stand, and if maybe you kind of block, you could teach him to block
Yeah.
that leg while he lifts his body up with the strong leg
Mhm.
to get in that way. Or let's say he can't do it safely. Is there something you could recommend?
Could recommend a ramp and a wheelchair.
Okay, you can recommend a ramp. Ramp would be hard when they're leaving like today or tomorrow,
Yeah.
right? But it's always what you would recommend. You could say, I would recommend a ramp, but if they can't do that, you can actually teach them to use the
So we'll
wheelchair.
get OT and that's it. Do you guys have any other questions?
I don't think so. We can just get that list.
Yep. I'll send you with that in the discharge note. We'll talk to the social worker as well about helping you find some the grab bar, the shower chair, and that kind of stuff as well. Okay?
Sounds good.
Cool. That's it.
Appreciate it.
Okay.